Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to diagnose cervical radiculopathy. It's actually very simple to diagnose it if you know those 3 key symptoms and signs of cervical radiculopathy, and I will go over some of the tests you will be able to do it at home that could indicate the possibility of cervical radiculopathy. So first, what is cervical radiculopathy? It's actually a pinching on the nerve root that attached to the spinal canal and usually happen around this area on this side or on the opposite side. And when you have compression on this area, it actually compress on the nerve that going down to your arm and will cause the radiculopathy or the nerve pain. So usually happen due to inflammation, swelling in this area, or could be damage from injury, from accident, from trauma. To visualize it, this is the skull, the head, and this is the cervical spine here. And you have the nerve root coming here and the nerve distribution coming down to your arms. And when you have cervical radiculopathy, usually this is the area or this is the area, either side or sometimes actually both sides, but it's common with one side, that you will have something compressing on the nerve root, either inflammation, herniated disc, or other damaged tissue that compressing on the nerve and cause the nerve pain that you will experiencing in your arm. So as you see here in this image, you have the cervical spine that's distributing those areas in arm, shoulder, and hand. And when you have compression on the nerve root or even compression in different areas of the nerve, when it goes down, you start to have those nerve pain that distribute into the shoulder, the arm, the forearm, and the hand. As you see here, the C is a stand for cervical spine. So that's the nerve distribution from the cervical spine. So the first sign for the cervical radiculopathy is numbness and tingling, and that's happen if you have issue or compression on C5. You're gonna have the numbness and tingling in the C5 distribution. If it's C6, it will be in the nerve that's applying the C6 distribution, so you will have it in your thumb here. If it's a C7, you will have it in those fingers here. If it's in the C8, you will have it on those nerve that's apply the C8. So that's the nerve distribution and show you where you're gonna have the numbness and tingling in the upper extremity related to the nerve that compressed. So the first sign is numbness and tingling. Second sign is muscle weaknesses. So when you have something compressing on the nerve will not conduct properly, so your muscle gonna be weak. It's very common with those patients saying, when I hold the cup, it's immediately fall from my hand, it drop from my hand because my hand muscle are weak. I feel very weak. I'm not able to push, to pull, or grab. I don't feel that strength that I used to have before. I feel it is getting very weak. So muscle weaknesses is a second sign. The third sign of cervical radiculopathy is loss of sensation. So you start to have problem with sensation, and it's also related to each of those nerves that is compressed. So if you have C6 loss of sensation, so your sensation gonna be lost in your thumb and half of your index finger, like here. So if it's C5, it's gonna affect this area. You lose sensation here. So it's related to each of those nerves that been entrapped or have compression on, will lose the sensation related to those nerves. So in clinical setting, There's two tests we usually do to determine if there is a possibility of cervical radiculopathy. So one of the tests is a compression test, and that test has to be done by someone else. You cannot do it on yourself. So this is a skull here, and you have the cervical spine here. The compression test is very simple. I'm gonna do it here in the front of you, but someone need to do it to test you for it. So basically, the skull here, right in here, I put my hand on the top of the skull and very gently go downward. That's called the compression test. Go downward on the skull, very gentle, compressing the cervical spine. And the positive test is when I do the compression here, you start to have more numbness, tingling, weaknesses, or loss of function in your hand. So increased symptoms. So compression test, it's compressing downward this way, going this way, to compress on the nerve more, that cause radiculopathy pain, and you start to have sharp shooting pain. That's a positive compression test. The other test we do in the clinical setting is called distraction test. That's basically going behind the skull in here and putting my hands like this under the skull and distract it upward. And when I distract it upward, that will decrease the symptoms because I'm opening the space here in a cervical spine. So when I distract it, it relieves the pressure on the nerve, and that decreases the symptoms. That's a positive test. So the two tests is compression test and distraction test. And I will leave a link underneath this video for the three most powerful treatment that you have never heard of for treating the root cause of cervical radiculopathy naturally. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.